Welcome back to Health Code Blueprint. Today we're continuing our journey through the ICD 10cm guidelines for Chapter 15, Pregnancy, Childbirth, and the Puerperium. In the first video, we covered the foundational rules that shape obstetric coding. Now, in Part 2, we're going to move into the more advanced areas of this chapter. In this session, we'll walk through the clinical timeline, how to correctly identify and code sepsis in pregnancy, how substance use impacts code assignment, and how to sequence external factors like abuse, poisoning, and COVID-19. These are the areas where coders often get tripped up, so by the end of this video, you'll feel much more confident navigating these scenarios. As always, this presentation is for educational purposes only. It's not legal, compliance, or billing advice. Make sure to follow official guidelines and your organization's policies when making coding decisions. Let's start with the clinical timeline, because understanding the timing is essential for choosing the right codes. The peripartum period spans from the last month of pregnancy all the way through 5 months postpartum. But for coding purposes, the postpartum period is specifically the 6-week window after delivery. Any complication that occurs within those 6 weeks is considered a postpartum complication. If a patient delivers outside the hospital and then comes in for routine postpartum care with no complications, the principal diagnosis is Z39.0. There's one important exception: pregnancy-associated cardiomyopathy, coded as O90.3. Even though it's diagnosed in the 3rd trimester, it can continue or worsen months after delivery. And remember, this code is only used when the patient does not have pre-existing heart disease. Now let's talk about O80, the code for a full-term, uncomplicated delivery. O80 is an exclusive code, which means if you use it, it must be the principal diagnosis, and all criteria must be met. Here's the checklist. The patient was admitted for a full-term, normal delivery. A single, healthy infant was delivered. The only outcome code allowed is Z37.0, single live birth. Any complications must have resolved before admission. And here are the deal breakers: any antepartum, intrapartum, or postpartum complications. Any other Chapter 15 code needed to describe a current condition, or a multifetal delivery. If even one of these applies, O80 cannot be used. When it comes to sepsis in pregnancy, the distinction between puerperal sepsis and standard sepsis is crucial. If the sepsis is related to pregnancy, childbirth, or the postpartum period, the correct principal diagnosis is O85, puerperal sepsis. You should not assign A40 or A41 as the principal diagnosis in these cases. The coding structure looks like this: principal, O85. Secondary, B95 B96 to identify the organism. And if severe sepsis is present, add R65.2 plus any organ dysfunction codes. One important note: do not use O85 for sepsis following an obstetrical procedure. In those cases, follow the guidelines for post-procedural sepsis. Substance use during pregnancy or postpartum requires careful sequencing. For alcohol use, the primary code is O99.31, and you must add a secondary code from F10 to identify the alcohol-related disorder. For tobacco use, the primary code is O99.33, and you'll add a secondary code from F17 to identify the type of nicotine dependence. These codes apply whether the use occurs during pregnancy or in the postpartum period. Next, let's look at drug use and toxic exposures. For drug use, whether it's illegal substances or prescription misuse, you'll assign primary, O99.32. Secondary, a code from F11 F16 or F18 F19 to identify the specific substance and manifestation. For poisoning or toxic effects, sequencing is everything. First, O9A.2, injury, poisoning, and consequences of external causes complicating pregnancy. Second, the specific poisoning or toxic effect code. Third, any additional codes describing the condition caused by the poisoning. This ensures the pregnancy-related impact is captured first. When abuse complicates pregnancy, childbirth, or the postpartum period, there's a strict sequencing hierarchy. First, assign the appropriate abuse code: physical, sexual, or psychological. Second, assign codes for the injuries, such as fractures or bruising. Third, assign the perpetrator code. This order ensures accurate reporting and supports both clinical and safety documentation. COVID-19 adds another layer of complexity, so let's break it down. If the reason for admission is COVID-19, sequence, principal, O98.5. Secondary, U07.1. Additional codes for manifestations. If the patient has COVID-19 but is admitted for something else, like labor or trauma, then principal, the reason for admission. Secondary, O98.5. Additional, U07.1. Manifestation codes. And remember the golden rule: if the pregnancy is affected, Chapter 15 codes take sequencing priority. This slide covers several important scenarios. If there's an attempted termination with a live-born fetus, assign Z33.2 plus the appropriate Z37 outcome code. If the patient has retained products of conception without complications, use O03.4 for spontaneous abortion or O07.4 for failed termination, even if the patient was previously discharged with a complete diagnosis. If there are complications, assign the specific complication code from O03, O04, or O07. Do not use O03.4 or O07.4 in those cases. And here's a key alert: for hemorrhage following elective abortion, use O04.6, never O72.1, which is only for postpartum hemorrhage. When a complication from pregnancy or delivery leads to long-term consequences, you'll use O94, but not as the principal diagnosis. Sequence it like this. First, the specific condition or sequela. Second, O94. This code can be used at any time after the initial postpartum period. This final slide brings everything together with a quick reference table. Normal delivery, O80 with Z37.0 only. Puerperal sepsis, O85 with B95, B96 and R65.2 if severe. Substance use, O99.3X with F codes. Poisoning, O9A.2 followed by poisoning and condition codes. Abuse, O9A.3, O9A.5 with injury and perpetrator codes. COVID-19 admission, O98.5 with U07.1. Sequelae, the condition first, then O94. This table is a great way to double-check your sequencing before finalizing your codes. Thank you for joining me for part 2 of our Chapter 15 series. These advanced topics can feel overwhelming at first, but with practice, they become second nature. In our next video, we'll continue building your confidence with more real-world scenarios and coding applications. Until then, keep learning, keep practicing, and I'll see you in the next video.